Hey everyone, this is Dr. Pat from the Springfield Wellness Center, your favorite Springfield, Illinois chiropractor. And today we're going to talk about migraines. Migraines are one of the most debilitating forms of headaches that people can have. And every day we hear stories from patients not only of how bad the pain is, but also the effect that it has on their lives. So every day hearing people talk about missing out on work or school or family activities, vacations, all these fun things in life that we have that they're not able to enjoy because they're having these migraine episodes. Now we know migraines have many different causes. It can be things like physical problems, and that's what chiropractors are well positioned to help with. So if it's an issue with a subluxation in your spine, if it's a muscle problem, if it's a disc problem, if it's all of the above, chiropractors can help, and we do so on a daily basis. We know that migraines can have other sources though, and other causes, things like hormones, things like diet. Those are other key elements that we want to make sure we pay attention to. But if there's something that can be helped with here at a chiropractic office, it's going to be those mechanical, physical problems that can actually be worked on. Now, as far as migraines go, they have many different unique characteristics that help us identify that we are dealing with a migraine. Number one, migraines tend to cause a deep, severe throbbing pain that can be felt pretty constantly throughout an episode. Now classically, it's going to be either on one side or the other. It usually isn't on both sides at the same time. It can also feel a really deep, uncomfortable feeling behind the eye as well. And these are types of cases where people just want to go to sleep. They want to keep their eyes closed, be in a dark room, and just go to sleep. And along the lines of being in a dark room, another thing with migraines is the light sensitivity and also sound sensitivity. So people want to be closed off in a dark room, sleeping because they want to stay comfortable and hopefully let the episode pass. So with migraines, it's one of those things that it really takes away everything that you want to be doing, and that's no good. We don't want that. Another key feature of migraines is that they have, or they can come with, a type of aura or a visual disturbance. Usually happens before the episode actually happens. When that episode is coming, you'll know because you can have some of these visual changes, bright lights or flickering in your visual field, and that's when people will know that they're about to have a migraine. So it's good to have a warning so you can know when it's coming, but it's also not a good feeling knowing you're about to have quite a bit of pain. So as far as what we can do to help with migraines, many different things. If it's a subluxation, as chiropractors, we are the experts at treating subluxation and helping to remove that interference in the nervous system. If it's a muscle problem, doing things like soft tissue work, massage therapy can be very, very helpful in aiding to relieve that tension and help get rid of the migraine in that fashion. Also, exercise is very important. Obviously, nobody wants to exercise when they're in the middle of a migraine episode, but doing the right things to help with our posture and help stimulate blood flow to the brain, especially through exercise, can definitely make a big difference towards helping the body and the brain heal, so that hopefully in the future we can get past these episodes and you can get back to living the life that you want to live. That's really what this is all about. It's getting you back to enjoying the things you want to, that migraines have taken away from you in the past. So if you're having migraines and you're suffering and you're looking for options, call us. The Springfield Wellness Center is well positioned to help you with this problem, and we'd love to sit down and talk to you to see how we can help you with this.